Now, our topic is homocystinuria. Homocystinuria, it is an inherited metabolic disorder of methionine catabolism. As we know that the methionine, it is catabolized into the homocysteine, and this homocysteine, then it revert back, convert into the methionine. And here in homocystinuria, the name itself indicates that homocysteine in urine. So it is an inborn error of methionine catabolism, and here this is a group of disorder of methionine metabolism. It is characterized by the high blood and urinary level of homocysteine and methionine. So it is classified into four types. Type 1, that is homocystinuria type 1, homocystinuria type 2, homocystinuria type 3, and homocystinuria type 4. So in these, the most common is the homocystinuria type 1. So it is the most common type, and here, as we know that the homocysteine, it get convert into cystathionine. As we know that the homocysteine, it get converted into cystathionine, and for this activity there is a need of enzyme, that is a cystathionine beta synthase. But in this disorder there is inherited deficiency of this cystathionine B synthase, and because of this deficiency there is an accumulation of homocysteine, and this homocysteine, it appears in urine. That's why it is called as homocystinuria. And this accumulated homocysteine, it get converted into methionine. Then there is a methionine level is also elevated in urine. Okay, so this enzyme is deficient, that is cystathionine beta synthase. It is deficient in homocystinuria type 1. That's why there is a excretion of homocysteine in urine, and it is a most common type. Now, what are the clinical features? What are the clinical features of this homocystinuria? So here, due to the inherited deficiency of enzyme cystathionine beta synthase, homocysteine cannot be metabolized to cysteine and propionyl-CoA as in a methionine catabolism. As a result, there is an accumulation of homocysteine. There is accumulation of this homocysteine, and this accumulated homocysteine, it appears into the urine. That's why the homocysteine, it is seen in a urine. And here this accumulated homocysteine, it also increases in a manifold. It is called as a hyperhomocysteinemia. There is a hyperhomocysteinemia, and there is an elevated level of methionine as well. So this accumulated homocysteine, the clinical features are, the most common finding is a mental retardation. The most common finding is a mental retardation seen in a homocystinuria. Why it is so? Because of the accumulation of homocysteine, and this accumulated homocysteine, it is responsible for the alteration in the metabolism of another amino acid in brain, and that impairs normal development of brain. So it is the most common finding or earliest finding seen in homocystinuria. Then next finding is the ectopia lentis. Ectopic means that is not on the normal position, and lentis means lens. So the position of lens, it is on not on normal side, it is deviated toward nasal side. So here you can see this is your lens which is deviated toward nasal side, and this condition is called as the ectopia lentis. Similarly, here there is a skeletal abnormalities. These skeletal abnormalities, it is because of the it is believed that the homocysteine react with the collagen and interferes with the cross linkage of collagen. So the collagen, it is not properly cross linked, so patient may present with the osteoporosis like symptoms. So here there is a osteoporosis. This homocystinuria, in this condition, there is a they are prone to the thrombosis. Here these patients are prone to the thrombosis, and this it is also responsible, it is one of the risk factor for atherosclerosis. So homocystinuria, it is one of the risk factor for atherosclerosis. And here you can see that in urine there is a excretion of homocysteine. So for the detection of this homocysteine, there is a test called as a cyanide nitroprusside test. Cyanide nitroprusside test, it is performed to detect the presence of homocysteine in urine. So cyanide nitroprusside test, it is a test which is used for the detection of homocysteine in urine. Okay. Then now this is a suppose this is a homocysteine molecule, and this homocysteine molecule which is responsible for injury to the arterial wall. To this arterial wall there is injury, and in tunica intima there is a entry of this oxidized LDL, and this oxidized LDL, it is responsible for the deposition of fat into the tunica intima. Once this is accumulated, which is responsible for narrowing the lumen, and this condition is called as a atherosclerosis. It is responsible for blood clot thrombus formation in your circulation. And here you can see this is a homocystinuria type 1, and in which in treatment some type of homocystinuria, it is responsive to vitamin B6 therapy. As it's vitamin B6, it is required for the activity of cystathionine beta synthase. So this homocystinuria type 1, it is responsive to vitamin B6 therapy. But sometimes this homocystinuria, it is a non-responsive to vitamin B6 therapy. Sometimes this is a non-responsive to vitamin B6 therapy. So how can we manage this condition? So in this condition, the diet should be low in a methionine. Here the diet should be low in methionine, so that if there is no methionine, there will be no homocysteine formation. Okay, this is about homocystinuria type 1. Then we have a second type, that is a homocystinuria type 2. So in this condition, as we have discussed, that conversion of homocysteine to methionine, for the conversion of homocysteine to methionine, there is a need of a methyl group, and the donor of methyl group is a methyl cobalamin. Now this cobalamin, it takes methyl group from N5-methyl tetrahydrofolate. Okay. Now this N5-methyl tetrahydrofolate donate methyl group to cobalamin, and from this cobalamin get converted into methyl cobalamin, and this methyl cobalamin donate methyl group to homocysteine, which get converted into methionine. But again, the substrate for this N5-methyl tetrahydrofolate is N5-N10 methylene tetrahydrofolate. This N5-N10 methylene tetrahydrofolate, which is a substrate where this the enzyme is N5-N10 methylene tetrahydrofolate reductase, which converts N5-N10 methylene tetrahydrofolate to N5-methyl tetrahydrofolate, and the name of enzyme is N5-N10 methylene tetrahydrofolate, where we are using NADPH for this activity, and here you will get N5-methyl tetrahydrofolate. Now in type 2 homocystinuria, there is a deficiency of this enzyme N5-N10 मिथिलीन टेट्राहाइड्रोफोलेट, ये एंजाइम यहाँ पे डिफिशिएंट है. सो N5N10 मिथिलीन टेट्राहाइड्रोफोलेट का कन्वर्शन N5 मिथिल टेट्राहाइड्रोफोलेट में नहीं होगा. So because of that, there is a no donation of methyl group from N5 methyl tetrahydrofolate to cobalamin. कोबालामाइन से मिथिल कोबालामाइन नहीं बनेगा, और अगर मिथिल कोबालामाइन नहीं बना तो होमोसिस्टीन का कन्वर्शन मिथियोनिन में नहीं होगा. ओके, दैट्स व्हाई देयर इज अ होमोसिस्टिन्यूरिया टाइप 2. ठीक है. Now here you can see that there is a conversion of tetrahydrofolate to N5N10 methylene tetrahydrofolate. So we have seen in the conversion of serine to glycine, where the 2-methyl group from serine, it goes to this tetrahydrofolate so as to form N5N10 methylene tetrahydrofolate. And after removal of methyl group from this methylene group from this serine, it get converted into glycine. So this is a step we discussed in a glycine metabolism, and where tetrahydrofolate get converted into N5N10 methylene tetrahydrofolate. और यहाँ पे कौन सा एंजाइम डिफिशिएंट है, N5N10 methylene tetrahydrofolate reductase, that's why there is a homocystinuria. Okay, now yes, here you can see that the serine which get converted into glycine, और यहाँ का जो ये वाला CH2 ग्रुप है ये यहाँ से चला गया टू दिस टेट्राहाइड्रोफोलेट, टू ये N5 और ये N10। यहाँ पे देखो ये N5N10 है, दिस N5N10 मिथिलीन टेट्राहाइड्रोफोलेट कैसे बना, यहाँ का जो CH2 ग्रुप है यहाँ से गया टेट्राहाइड्रोफोलेट को। दैट्स वाई during conversion of serine to glycine by the action of enzyme serine hydroxymethyl transferase, there is a conversion of tetrahydrofolate to N5N10 methylene tetrahydrofolate, और ये डोनेट करेगा, ये N5N10 मिथिलीन टेट्राहाइड्रोफोलेट कन्वर्ट होगा N5 मिथिल टेट्राहाइड्रोफोलेट में। ओके, और वो डोनेट करेगा मिथिल ग्रुप टू द कोबालामाइन, और कोबालामाइन कन्वर्ट होगा मिथिल कोबालामाइन में। ओके, टाइप 3 में देखो अभी, now here we have a N5 methyl tetrahydrofolate, it is a perfect here, but in type 3 the enzyme which transfer methyl group from N5 methyl tetrahydrofolate to cobalamin, ये वाला एंजाइम absent, is N5 methyl tetrahydrofolate methyl transferase, this enzyme is deficient in homocystinuria type 3। टाइप 3 में ये वाला एंजाइम absent है, दैट्स वाई ये मिथिल ग्रुप टेट्राहाइड्रोफोलेट से कोबालामाइन को नहीं जाएगा, and there is no formation of active methyl cobalamin, and there will be no conversion of homocysteine to methionine, homocysteine conversion methionine में नहीं होगा, that's why it is called as a homocystinuria type 3। okay, now last type, that is a homocystinuria type 4। so here it is due to the defect in the intestinal absorption of vitamin B12, जो विटामिन B12 जो इंटेस्टाइन से एब्सॉर्ब होने वाला था उसी का एब्सॉर्प्शन में डिफेक्ट है, and if there is a no cobalamin there will be no formation of active methyl cobalamin or methyl cobalamin that will not donate methyl group to homocysteine, और homocysteine methyl group में कन्वर्ट, homocysteine methionine में कन्वर्ट नहीं होगा। okay, now how to manage this condition? So defect, in first defect we have seen that whenever there is the deficiency of cystathionine beta synthase, that can be corrected with the vitamin B6, if it is responsive then it is okay, and this pyridoxine which needed to activate enzyme cystathionine synthase, but sometime the patient will not show any response to this vitamin B6। okay, those with a complete deficiency of enzyme, whenever there is a complete deficiency of enzyme, it should be treated with a diet low in a methionine and supplemented with cysteine। diet low रखना है methionine से, और you can supplement with a cysteine, and vitamin B12 can be given if there is a vitamin B12 deficiency. If there is a deficiency of vitamin B12, you can provide vitamin B12 by intramuscular route as well if there is a defect in absorption of vitamin B12 from intestine, that is a type 4 homocystinuria। This is all about disorder of this methionine metabolism, and in which it is a most common one is a homocystinuria, and it has a 4 type 1, 2, 3 and 4। okay, so please like, share and subscribe my videos. Thank you.